Cancer is a complex disease. It starts when cells in the body grow uncontrollably. Normally, cells grow and divide as needed, then die when they are old or damaged. In cancer, this process goes wrong. Old or damaged cells survive and new cells form when not needed. These extra cells can form a mass called a tumor. Not all tumors are cancerous. Benign tumors are not cancer and do not spread. Malignant tumors are cancerous and can invade nearby tissues. They can also spread to other parts of the body through the blood and lymph systems. This process is called metastasis. Cancer can start almost anywhere in the body. Each type of cancer has its own characteristics and treatment options. Early detection and treatment are vital for improving outcomes.
There are more than 100 types of cancer. Each type is named for where it starts. For example, lung cancer starts in the lungs and breast cancer starts in the breast. Here are some common types of cancer. Breast cancer. This type of cancer forms in the cells of the breasts. It is most common in women, but men can get it too. Symptoms include lumps, changes in size or shape, and nipple discharge. Lung cancer. This cancer starts in the lungs. It is strongly linked to smoking. Symptoms include a persistent cough, shortness of breath, and chest pain. Early detection is key to treatment. Prostate cancer. This type affects the prostate gland in men. It usually grows slowly and may not show symptoms early. Regular screenings can help detect this cancer early. Colon and rectal cancer. This cancer starts in the colon or rectum. Symptoms include changes in bowel habits, blood in the stool, and abdominal discomfort. Screenings like colonoscopies can help find it early. Understanding the type of cancer is important for choosing the best treatment.
Several factors can increase the risk of developing cancer. These factors can be lifestyle-related, environmental, genetic, or age-related. Here are some common risk factors. Lifestyle factors. Smoking is one of the biggest risk factors for cancer. It is linked to lung, mouth, throat, and other cancers. Diet also plays a role. A diet high in processed foods and red meat can increase the risk of colon cancer. Lack of physical activity and obesity are also risk factors. Environmental factors. Exposure to certain chemicals and radiation can increase the risk of cancer. For example, asbestos exposure can lead to lung cancer. Ultraviolet radiation from the sun can cause skin cancer. Occupation-related exposures can also be a risk factor. Genetic factors. Some people inherit genetic mutations that increase their cancer risk. For example, BRCA1 and BRCA2 genes are linked to breast and ovarian cancer. Family history plays a significant role. If close relatives have had cancer, the risk may be higher. Age-related factors. The risk of cancer increases with age. Most cancers are diagnosed in people over 50. Understanding these risk factors can help in taking preventive measures. Regular screenings and genetic counseling can also help in early detection.
Cancer symptoms can vary widely. They depend on the type and location of the cancer. Here are some common symptoms to look out for. Unexplained weight loss. Losing weight without trying can be a sign of cancer. This is especially common in cancers of the stomach, pancreas, esophagus, and lung. If you lose more than 10 pounds without a reason, see a doctor. Fatigue. Extreme tiredness that doesn't get better with rest can be a symptom. It is common in leukemia and lymphoma. Fatigue can also be a sign of cancers that cause blood loss, like colon or stomach cancer. Pain. Persistent pain, especially if it is severe, can be a sign of cancer. For example, back pain can be a symptom of ovarian cancer, while headaches can indicate brain cancer. Changes in skin. Skin changes can signal skin cancer. Look for new growths, sores that don't heal, or changes in moles. Recognizing these symptoms early can lead to timely diagnosis and treatment. If you notice any unusual changes in your body, consult a healthcare professional. Section 5. Importance of early detection. Early detection of cancer is crucial. It can improve the chances of successful treatment. Regular screenings and being aware of symptoms are key components of early detection. Screenings. Screening tests can find cancer before symptoms appear. Mammograms can detect breast cancer early. Pap smears and HPV tests can find cervical cancer. Colonoscopies can detect colon cancer. Low-dose CT scans can screen for lung cancer in heavy smokers. Self-exams. Regular self-exams can help in early detection. For example, monthly breast self-exams can help women detect lumps. Skin self-exams can help identify new or changing moles. Awareness. Being aware of the common symptoms of cancer is important. Knowing what to look for can prompt early consultations with a doctor. Early-stage cancers are often easier to treat and have better outcomes.
Section 6, treatment options. There are several treatment options available for cancer. The choice of treatment depends on the type and stage of cancer. Here are some common treatments. Surgery is often used to remove the cancerous tumor. It can be curative if the cancer is localized. Surgery may also involve removing nearby lymph nodes. Advances in surgical techniques have made procedures less invasive. Chemotherapy uses drugs to kill cancer cells. It can be used alone or with other treatments. Chemotherapy targets rapidly dividing cells, but it can also affect healthy cells. Side effects include nausea, fatigue, and hair loss. Radiation therapy uses high-energy rays to kill cancer cells. It can be used to shrink tumors before surgery or to kill remaining cells after surgery. Radiation can also be used to relieve symptoms. Side effects include skin changes and fatigue. Targeted therapy uses drugs that target specific molecules involved in cancer growth. Immunotherapy boosts the body's immune system to fight cancer. These therapies can be more precise and have fewer side effects than traditional treatments. Combining different treatments can be more effective.
Section 7. Coping with a cancer diagnosis. A cancer diagnosis can be overwhelming. It is important to find ways to cope. Here are some strategies that can help. Joining a support group can provide comfort and understanding. Sharing experiences with others who are going through the same thing can be very helpful. Support groups can be in person or online. Professional counseling can help in dealing with the emotional impact. A counselor can provide strategies for coping with anxiety, depression, and stress. Counseling can be individual or for the whole family. Staying active can improve mood and overall well-being. Gentle exercise like walking or yoga can be beneficial. Always consult with a doctor before starting any exercise program. Eating a balanced diet can help the body cope with cancer treatment. It can also improve energy levels and overall health. Remember, it is okay to ask for help.
Section 8. Prevention tips. Preventing cancer is one of the best strategies. Here are some tips to reduce your risk. Eat a diet rich in fruits, vegetables, and whole grains. Limit processed foods and red meat. Choose lean proteins like chicken, fish, and legumes. Smoking is a major cause of cancer. Quit smoking and avoid secondhand smoke. There are many resources available to help quit smoking. Staying active can reduce the risk of several types of cancer. Aim for at least 30 minutes of moderate exercise most days of the week. Activities like walking, swimming, and cycling are good options. Drinking alcohol can increase the risk of cancer. Limit alcohol consumption to moderate levels. Regular medical checkups and screenings can detect cancer early. Follow recommended guidelines for screenings based on age and risk factors. Making healthy lifestyle choices can significantly reduce the risk of cancer.
Section 9. Conclusion and resources. Facing cancer can be challenging, but remember, you are not alone. Many resources and support systems are available. Here are some final thoughts and resources. Educate yourself about your type of cancer and treatment options. Knowledge can empower you to make informed decisions. Reliable sources include the American Cancer Society and the National Cancer Institute. Lean on family, friends, and support groups. Professional counseling can also be beneficial. Do not hesitate to ask for help when needed. A positive mindset can make a significant difference. Focus on things you enjoy and find ways to stay hopeful. Many people live full lives after a cancer diagnosis. There are many organizations that provide support and information. The American Cancer Society offers resources for patients and families. Stay strong, stay informed, and reach out for help when needed.